Hi everyone, and welcome to my presentation. My name is Orga Chong, and I'm with Brahman University. The health topic I chose from Healthy People 2020 was diabetes. I chose it because initially we were in groups and one of the group members had a clinical scholarly project on diabetes. It is also widely manifested in many patients, and on any given shift I will have at least 1 to 3 diabetics out of 5 patients. Therefore, I thought working on diabetes will certainly help me as a family doctor of nursing practice. Moving forward with this presentation, I will briefly talk about the basic information on diabetes so you have some background information. Next, I will show you a small town in Camarillo, California as an example of a typical city in the United States. I will discuss the change theory and how it can pertain to a diabetic. Next will be my patient educational meme to show the simplicity of a picture in its 1,000 words. Lastly, I want to show you a professional piece of education called MyPlate that diabetics can use. Here is basic information, diabetes in a nutshell. I designed this as a frequently asked questions or FAQs of a patient learning that they have been diagnosed with diabetes.
My doctor says I have diabetes. What does that mean?
Well, diabetes is a chronic health disease where the body has a hard time controlling sugar. You see, your body uses sugar as energy, which comes from food. Too much sugar and the body detects that this your body detects and will release a chemical called insulin to lower the sugar levels. Most people fall into 2 types of diabetes. Type 1, your body doesn't make enough insulin to begin with. Type 2, it makes the insulin, but the insulin has a hard time to stick to the sugar. In your case, Mr. Pumpkin, you have type 2 diabetes.
Is it deadly?
No, but if the sugar is uncontrolled, there are unwanted complications. If you want to go a few days with your sugar too high, you'll get very thirsty, you have trouble concentrating, and you pee a lot. On the opposite hand, if you go a few days with too low sugar, you'll get dizzy, shaky, sweaty, pale, and you might even pass out. And just so you know, about 29 million people in the United States have diabetes, and 1/4 of them don't even know they have it.
Oh, wow. Well, what do I have to do then?
Knowing is half the battle. You have to help your body control the sugar levels. If it's too high, take some medication to lower it. If it's too low, drink some juice. Overall, you'll want to eat a well-balanced diet. Get some exercise and see your doctor regularly. Oh, and schedule a routine foot and eye exam. Which then brings me to the focus which I want to teach for this health communication project, which is eating a well-balanced diet. Next, I did a reconnaissance of a typical town in America called Camarillo. The location is in the southwest section of California. It has approximately 65,000 people and one local hospital called Pleasant Valley Hospital. Camarillo has several clinics in the area that are owned by government, private, and nonprofit organizations. Camarillo's health care is owned by its county called Ventura County Health Care Agency. The information can be found at www.camhealth.com. Information can also be found at the local Camarillo Library. Local pharmacies like Walmart can help give vaccinations to people without insurance. One of the local schools called Los Primeros has a kindergarten vaccination rate that exceeds the average vaccination rate for the nation. I'd like to discuss my idea on how to change a diabetic's diet. I'd like to introduce the change theory, or also known as, or aka, trans-theoretical model. This model assesses the readiness to change a behavior. It guides the new behavior until it becomes part of the daily life. It's helpful in order to design a health communication tool with objectives, messages, and strategies for someone or people. A little bit of background about this theory.
It was created in 1977 and derived from different psychotherapy theories and hence the name trans-theoretical model. Here are the 5 stages of change. First is the pre-contemplation stage, where someone is not ready but they are curious.
A healthy diet? Nah, not for me. But what is a healthy diet?
Second is a contemplation stage where the person is balancing the pros and cons.
Well, I don't want to lose a limb. I guess in this case, my stem on my head.
Third is a decision stage where the person feels ready and starts experimenting.
Well, I guess I could try eating an apple instead of French fries. It's not bad.
Fourth is the action stage where a person is making modifications to suit his wants.
Let me try a green apple instead of a red one.
The fifth stage is a maintenance where the pumpkin is keeping this daily habit for 6 months without any relapse. For my health communication portfolio and plan, I want to use memes. They are eye-catching, fun, has a picture, and a simple phrase. I have created 2 to show you. The first one is Taste the Rainbow, as a play on with the Skittles motto. Instead of Skittles of different colors, I use real fruits and vegetables to taste the rainbow. Hopefully, a diabetic can see this and easily remember to include fruits and vegetables into his diet. The second meme I created was a play on the McDonald's old model of ba-da-da-da-da, I'm loving it. Here, my daughter found me a heart-shaped strawberry and gave it to me, telling me that she loved me. It's very sentimental, but also, in a way, a diabetic can use a simple heart-shaped strawberry and a positive phrase to remember that eating healthy can be full of love. Whether it's love for themselves or for their fruits, it adds a positive attitude towards a healthy diet. My next plan is to use a blog post. Here is an example of my diabetes in a nutshell on a blog space. The average patient can come to a blog site like this and see diabetes information and get some of their questions answered in a simple manner. Lastly, I chose a professionally done graphic art from the United States Department of Agriculture. The My Plate is a visual representation of how portion control and well-balanced diet should look like. Here, fruits and vegetables are half the diet and grains is a little more than a quarter of the diet. I just want to close saying that although I'm not a diabetic, I truly hope that some of these ideas of eating a well-balanced diet will stick. And just like the pumpkin and the change theory, changes do not have to be a sudden turn of life. They can start simple, such as eating an apple instead of French fries, then slowly adapting this lifestyle to suit your needs. I just want a healthy diet change for a diabetic. Remember the love. Thank you for watching my presentation. Have a nice day.